everyone, to my classmate and especially to our clinical instructor, Ma'am Charmin Abenes. Hi, my name is Katrina di Untalasco, PSL2B, and I'm going to perform a return demonstration about essential newborn care. So this is a series of time-bound and evidence-based intervention for newborn babies and to their mothers to ensure the best care for them, and especially like unang yakap. This is very conceptualized order to have early initiation of breastfeeding, and this is the package of evidence-based practices that recommended by Department of Health, PhilHealth, and World Health Organization as a standard of care in all births by skilled attendants in all government and private. For the purposes of essential newborn care is to establish and maintain the patent area of the newborn, and to promote measures to prevent hyperthermia, and also to prevent any complication for the mother and the newborn, and also to prevent infection and record the observation of infant's condition. And the first step which we're going to do is check and identify the patient and also help her in her position while she's delivering her baby. But before that, prepare all the equipment. So I arrange all the instrument in a linear sequence, which is the vitamin K, the oxytocin, the hepatitis B, the BCG vaccine, the eye ointment, the kidney basin, the umbilical cord clamp, the 2 scissors, sterile plastic cord clamp, the syringes, surgical gloves, the clean gloves, the tape measure, dry clean linen, and bonnet that we're going to use for the baby. I'm going to perform hand washing and hand gloving of sterile gloves, so this step can reduce transmission of microorganisms. Okay, Ma'am Megan, calm down and relax yourself. Inhale, exhale, push. Inhale, exhale, push. Inhale, exhale, push. Baby boy out, 7:30 p.m. When the head is delivered, wipe the body of the baby, the mouth and the nose. Establish and maintain the patent period. The baby will place in a white clean linen or a blanket on a mother's abdomen, and also stimulate the baby while drying by rubbing up and down along the baby's spine. Dry the head of the baby, the eyes, nose, the extremities of the baby. Take note, do not sanction unless the airway is obstructed, and also to stimulate the baby to breath, do not wipe off the vernix, as this is continued to provide cover for the baby. Remove the wet cloth and place the baby in skin-to-skin contact in mother's abdomen. Removing wet cloth is very important because the newborn's body temperature can drop rapidly after birth, causing potential life-threatening neonatal hypothermia. The purpose of skin-to-skin contact is promoting the mother and child bond, breastfeeding success, lymphoid tissue system stimulation, exposure to maternal flora, and protection by hypoglycemia and thermoregulation. Cover the back of the baby with a blanket or dry clean linen, and also put a bonnet in a baby's head. And the next step is palpate the cord of the baby. And when the pulsation is stopped, clamp the cord using sterile plastic cord or umbilical cord clamp. And also clamp or cut the cord between 1 to 2 minutes. Clamp the cord in 2 cm and also clamp again at 5 cm from the base. I'm going to use umbilical cord clamp, so because I don't have extra sterile plastic cord clamp. And after that, cut the cord to the first clamp. Do not apply anything into the stump. So this is the placenta of the mother. Also keep the mother and the baby in uninterrupted skin-to-skin contact at least 60 to 90 minutes, even when transferring to the recovery room. And also for the identification of the baby, place the identification band on the baby's ankle, noting the name of the baby, the sex of the baby, the date, and the time of delivery. So, newborn's identification is very important step after the delivery because it can avoid switching of the babies or kidnapping to the healthcare facility. And also start taking vital signs after 50 minutes. Taking vital signs is very required because it can monitor the health status of the baby and the mother. And also watch the feeding cues of the baby at 20 to 90 minutes. The example of this is if the head of the baby is turning to look for the breast of the mother, or sucking on hand or lip smacking, and also assist the mother in latching or breastfeeding cues, and also note the time initiated and time stop. After that, perform hand washing and wear again sterile gloves. Performing hand washing and hand gloving will reduce the transmission of microorganisms. Care of the eye of the baby. Apply the Creed's prophylaxis on both eyes of the baby after the first breastfeed. So I'm going to use erythromycin and 1 drop in both eyes. Also, when using an ointment, depress the lower eyelid of the baby, and take note that be careful in the tip of the tube so that it does not touch the eye of the baby. Perform Apgar scoring correctly immediately after delivery of the baby and after the 5 minutes. Apgar score is used to assess the newborn's well-being through observation and rating the apical pulse of the baby, the respiratory effort, the muscle tone, the reflex irritability, and the color of the baby. Perform first complete physical examination to see if there is any abnormalities, and also take the anthropometric measurement, including the weight, head, height, chest, abdominal, arm, and thigh circumference of the baby. This procedure or this step is to measure a certain body proportion and condition of the baby. And also check for anal patency of the baby to see if there is abnormalities in the anal. Give vitamin K vaccine into lateral anterior thigh or vastus lateralis of the right leg of the baby. This vitamin K is to prevent the low levels of vitamin K and vitamin K deficiency bleeding. And also inject a hepatitis B vaccine for protection of the baby to any exposure of hepatitis B virus. And also inject BCG vaccine intradermal to protect the babies from serious forms of tuberculosis such as TB meningitis and miliary TB in the right arm of the baby. And this is the oxytocin to prevent the excessive postpartum bleeding by helping the uterus to contract, and this is given to the mother. Okay, Miss Megan, this is a medication to prevent hemorrhage in your body. Collect all the necessary supplies and dispose the syringe with needle, and use alcohol and wipe the injection site with alcohol using a cotton, and dispose the syringe in an appropriate and safe container for sharp instrument. Thermoregulate the baby at 36.5 to 37.5 Celsius. Keep the babies warm, like skin-to-skin contact in the chest of the mother, with the body covered by bonnet. And also, if the baby cannot be placed at skin-to-skin contact in case of cesarean section, or if the mother is ill, wrap the baby well and cover the head of the baby. Do not bat the baby for at least 1 to 6 hours of life. For a newborn screening after 24 hours, and I will encourage the mother about breastfeeding. Okay, Mom Megan, if your baby wants to breastfeed, just breastfeed him, okay? And do not give him any kind of sugar or formula, water, or any liquid, and do not use pacifier or any bottles. Is that okay, Ma'am? Thank you. For the last procedure is monitor, again, the vital signs and the respiratory distress. And for the cleaning, ensure the proper disposal of waste and the contamination of equipment that can be reused. And also remove the gloves after dipping them in the contamination solution. And after I remove the gloves, I will perform hand washing and drying the hand. The last procedure is record all the key data and information, which is note all the key information, record the pertinent information and nursing care done, and also report any sign and symptoms of deviation and abnormalities to the pediatrician. And once again, I am Katrina Untalasco, BSN2B, and thank you for watching.